UK Healthcare Community Connection is sponsored by UK Healthcare.
Couch is busy this morning. We are joined by Dr. Timothy Mullett from UK Markey Cancer Center.
This morning he's talking about lung cancer awareness, as November is Lung Cancer Awareness Month. For some background for people who may not be familiar with the state of lung cancer in Kentucky, can you kind of walk us through that?
Sure. Lung cancer in Kentucky, this is the leading cancer killer. We lose about 4,500 people a year to this disease. It is certainly most common in Kentucky. We carry the burden of the highest incidence of cancer in general, but certainly for lung cancer. So what we're really interested in is trying to decrease the risks associated with developing this disease, but also trying to find it a little early and see if we can decrease that mortality rate. We've seen lung cancer rates, the incidence of the disease, continue to go down. Mm-hmm. Tobacco use is diminishing, and so that's really a great thing for Kentuckians. And we're also seeing the mortality from that disease, the chance of dying from developing cancer, go down much more dramatically in Kentucky than we have in other states. So it's an interesting time for us, and this is an exciting time to talk about lung cancer.
Who is eligible for lung cancer screenings, and what steps should they take?
Right. So lung cancer screening is a way of finding this disease early. And if we find it early, we have a chance of, more likely chance of curing this disease. So many times surgery is the only thing that's necessary for a small spot that can be found. It's found on a CAT scan. A low radiation dose CAT scan is done every year for patients that are eligible. And those patients have an age of 50 to 80 and an exposure to tobacco. So we measure that in pack years of exposure, but the important thing is that if you're a tobacco user or have former tobacco user and you're approaching 50 years of age, you need to talk to your doctor about whether or not you're eligible for lung cancer screening.
I previously spoke with the Lexington VA, and they made a point to say that Markey Cancer Center is the gold standard. In your opinion, what kind of distinguishes the Markey Cancer Center apart from other cancer programs?
Well, it's very nice to hear of the statements from the VA. We have truly been privileged to be working with them as our most recent addition to our Markey Cancer Center affiliate network. That network is 20 hospitals across the state, and so we cover the entire state in that way. And we're able to work with those programs to increase their screening rates, increase their quality of all cancer care. And so this is a true privilege for Markey to be able to have an impact on the community. As an NCI designated cancer program, that's one of the measures that they're really looking at, is what are we doing to improve the outcomes for a state that carries the highest burden of cancer. And this has been our way of being able to reach into the community, connect the providers that are in the community with the providers that are at Markey, develop those relationships, and ultimately be able to have better outcomes.
Well, continue to fight the good fight. I know a lot of people appreciate all that you do.
Thank you very much.
All right.
We'll be right back after the break.